Welcome to the Mind Mechanic podcast, where I discuss topics ranging from general mental health to research about mental health disorders. Now, first, I want to begin with a poem by Chuck Audit that delves into the attention hyperactivity disorder, or ADHD, experience. This poem is called Adult ADHD. Adult ADHD has gotten me. Too much TV, can't you see? Surfing the web, can't concentrate. I'm at my job, but my brain is late. Chores at home, still not quite done. And I should exercise, but my mind has run. I want to write more. This is all I can do. Losing track. This poem's about who? Now, this poem exemplifies the day-to-day struggles of living with ADHD. For example, when Chuck says, too much TV, can't you see? And can't concentrate, I'm at my job. He is referring to his abnormal tendency to fixate on highly reinforcing stimuli and difficulty with focusing on tasks he finds uninteresting at his job. Now let's discuss this. ADHD has a global prevalence of 5.9 to 7.1% in children and 1.2 to 7.3% in adults, according to Huss and colleagues in 2017. Now, what ADHD is it's a neurodevelopmental disorder characterized by three subtypes: predominantly inattentive, predominantly hyperactive impulsive, and combined, according to Roderick and Wongzowit in 2013. Now, according to the DSM-5, released in 2012, a diagnosis requires that symptoms of inattention, hyperactivity, and impulsivity are observed in at least two different settings and must be present for 6 months or longer. The symptoms must also result in the impairment of social, academic, or other functioning, and the symptoms cannot be better accounted for by another physical or mental health condition or social situation. Now, ADHD is characterized by a complex etiology involving genetics, prenatal, and postnatal factors, according to Chen and colleagues in 2017, Ferron and Larson in 2019, and Thapar and colleagues in 2013. Motivational disturbances are frequently reported in these patients who show high comorbidity for developing mood and substance use disorders. For example, up to half of preschool and school-age children with the ADHD experience a comorbid mood disorder. Externalizing disorders, mood disorders included, implicate externalized symptoms affecting self-control, emotions, and behaviors, which, in childhood, predict depression in adulthood, according to Zisner and Beauchesne in 2016. In terms of neurobiology, ADHD is understood to be related to hypoactivity of dopamine and norepinephrine, also known as noradrenaline, in the motivation, reward processing, and executive function pathways of the brain, according to Eben Rothschild and colleagues in 2016. Now, Cirillo Urbina and colleagues in 2018 and Dalsgaard and colleagues in 2014 suggest that because of potential for adverse effects and the existence of particularly vulnerable populations, for example, those at risk for substance use disorder, require careful measures to be taken when prescribing the first line of treatment, stimulants, such as methylphenidate, which function to normalize activity on the previously mentioned pathways of the brain. This podcast will investigate methylphenidate as a treatment for ADHD. First, I will discuss etiological, genetic, and environmental factors of ADHD and the disorder's pathophysiology. I will then explore the appropriate administration of stimulant-based treatment to ensure the safest outcome and the neurobiological mechanisms of the stimulant methylphenidate in treating ADHD. I will also discuss the limitations of methylphenidate and contradictory evidence of its cardiovascular risks. The etiology of ADHD highlights a genetic component as well as influence from prenatal and postnatal factors. Ferron and Larson conducted a meta-analysis in 2019 that identified a substantial genetic component of ADHD. The mean heritability across 37 twin studies of ADHD, or measures of inattentiveness and hyperactivity, is 74%. Now, similarly, Penn and colleagues in 2017 found a heritability estimate of around 80%, seen in a study of monozygotic and dizygotic twins, full siblings, and maternal and paternal half-siblings. Now, according to these same researchers, the heritability is similar in males and females for the inattentive and hyperactive impulsive components of ADHD. Now, Thapar and colleagues in 2013 suggest that prenatal exposure to substances such as nicotine and alcohol, premature birth, low birth weight, and maternal stress during pregnancy are among the prenatal factors that have been associated with an increased risk of ADHD. Now, postnatal factors such as early exposure to lead or adverse childhood experiences, also referred to as ACE, have been shown to contribute to a greater incidence of ADHD, according to Thapar and colleagues in 2013. So this multifactorial etiology of ADHD is complemented by a well-researched neurochemical basis for the disorder. Now, before we move on, I wanted to play an audio clip from a TED Talk called Failing at Normal, an ADHD Success Story by Jessica McCabe.
I also learned ADHD is a terrible name for ADHD. It creates a lot of confusion. We don't have a deficit of attention. What we have trouble with is regulating our attention. As ADHD coach Brett Thornhill puts it, it's like your brain keeps switching between 30 different channels and somebody else has the remote. Sometimes we have trouble focusing at all, and other times we get stuck on a channel and can't pull ourselves away, which in real life might look like we just don't want to do homework because we'd rather play video games. And sure, sometimes that's the case. But the truth is, there are plenty of times we want to be able to focus. We try, and we just can't. Current understanding is that this difficulty has to do with the way our brains produce and metabolize neurotransmitters like dopamine and norepinephrine.
So what does Jessica's experience with difficulties in guiding her attention tell us about the pathophysiology of ADHD? Well, let me tell you, her story corroborates the current body of literature. The dysregulation of dopamine and norepinephrine and their hypoactivity in pathways involved in motivation, reward processing, and executive function have crucial and different contributions to the pathophysiology of ADHD. Dopamine and norepinephrine are centrally involved in mediating inattention, impulsivity, and hyperactivity, and symptoms of ADHD are associated with disturbances in dopamine and norepinephrine neurotransmission. Thus, according to Edmonds, Rothschild, and colleagues in 2016, dopamine is essential for maintaining goal-directed arousal. Now, more specifically, ADHD symptoms are suggested to be the result of dysfunctional learning and sensitivity to reward due to low hedonic tone. Now, what hedonic tone is it specifies the intrinsic attractiveness of a behavior, and this low hedonic tone is caused by dopamine hypoactivity, according to Sternat and Kazmat in 2016. Now, according to Volko and colleagues in 2011, this can cause impairments in motivation, driving inattention, and exaggerated impulsivity. Now, according to Fitzpatrick and colleagues and Liu and colleagues in 2019, norepinephrine was found to be released only in difficult task contingency states, but not during easy tasks during the 5-choice serial reaction time task, which is a task used to study the underlying mechanisms, including the neuroanatomy and neurochemistry of impulsivity. So according to Fitzpatrick and colleagues in 2019, this data supports the hypothesis that norepinephrine activity is essential to recruit and optimize cognitive performance in high-demand conditions, and is less relevant for previously learned information and is related to effortful processing. So, the dysregulation of dopamine and norepinephrine in related pathways enhances the underlying mechanisms driving the disorder, allowing for a better understanding of potential treatments. Methylphenidate, the most widely prescribed and most researched stimulant for ADHD, affects neurotransmission of dopamine and norepinephrine in the prefrontal cortex, mitigating the symptoms of ADHD. Methylphenidate blocks dopamine transporter and norepinephrine transporter, which reduces the reuptake of these neurotransmitters back into what is basically storage, and produces an increase in available dopamine and norepinephrine in the synaptic cleft, according to Nunes, Jaramillo, and colleagues in 2021. Now, these same researchers, in addition to Brown and colleagues in 2018, found that when this increase in available dopamine and norepinephrine is present in the prefrontal cortex, arousal is also enhanced in this region. This increase in concentration of dopamine and norepinephrine has been shown to enhance neurocognitive performance, such as working memory, variability in reaction time, vigilance, and response inhibition, according to Pievsky and McGrath in 2018. Now, Weiss and colleagues in 2019 found that 90% of patients treated with methylphenidate were able to achieve some symptom improvement, which is defined as at least a 30% reduction in symptoms. And 75% were able to see a 46% reduction in symptoms. So although many individuals find successful symptom improvement while undergoing methylphenidate treatment, there are limitations. Stimulant treatment can be dangerous if administered incorrectly, so careful steps should be taken to ensure the least adverse outcome. Now, as outlined by Brown and colleagues in 2018, stimulant treatment begins with a first stimulant medication, which is either methylphenidate or amphetamine, and they should increase the dose until a maximum symptom benefit is attained without significant side effects, or at the dose to which side effects are tolerable and the benefits outweigh the risk. Now, if one stimulant medication does not work at the highest appropriate dose, then a medical practitioner, usually a psychiatrist or a general practitioner in Canada, will then consider trying a different stimulant medication. Now, again, with that other stimulant medication, the medical practitioner should increase the dose up until maximum symptom benefit is achieved without significant side effects. Now, if stimulants have been tried without producing benefit in ADHD symptoms, or the side effects are not well tolerated, then the next step in ADHD medication management should be to consider trying non-stimulant medications. Now, according to Klein and Schwartz in 2002, if careful steps are not taken, the risk for unintentional overdoses due to medication errors alongside suicidal attempts increase. Signs of overdose include agitation, hallucinations, psychosis, lethargy, seizures, tachycardia, dysthemias, hypertension, and hyperthermia and ventricular arrhythmia, as well as common side effects such as anxiety, headache, insomnia, anorexia, and also tachycardia. And all these risks increase with dose elevations, according to Klein Schwartz in 2002 and Schelleman and colleagues in 2012. Now, along this medication management strategy for ADHD, the family and child or adolescents must be fully involved in the decision-making process about the use of medications. It is important to investigate potential concerns and practice good collaboration and communication with family, other medical providers, behavioral therapists, and of course, the child or adolescent school, according to Brown and colleagues in 2018. So, appropriate measures taken when administering stimulants are necessary to not only ensure the safest outcome for the patient, but to ensure that treatment is optimally effective and welcome. Now, before we delve into the limitations and risks of methylphenidate, I must mention that there is a lot of stigma regarding the use of stimulants. In particular, the media portrays the use of stimulants in a negative light. For example, Joyner Lucas confronts his daily struggles with ADHD and the pressure to fix himself with ADHD medications in his song called Revenge Intro/ADHD.
Fame, I wanted a name, I wanted a break, I wanted a love, I wanted a cake, I want to be great, I wanted to change and all the above. You want me to fall, you want me to crawl, you want me to stall, they want me on drugs, you want me to fail, they want me in jail, they want on my soul.
Now, it is important to mention that stimulant medications aren't a cure for ADHD. They are not tolerated by everyone, and the effects aren't appreciated by everyone. Many people respond to these substances differently. Joyner Lucas merely expressed his opinion of the medications in his song. As we previously covered, most people who take these substances experience a large reduction in symptoms. Now, through a research-based perspective, I will discuss some of the drawbacks. Stimulant treatment of ADHD, such as methylphenidate, is constrained in its effectiveness by varied response times, lack of conclusive evidence on long-term efficacy, and the emergence of adverse effects, including contradictions and cardiovascular risk findings. Now, as outlined by Weiss and colleagues in 2019, the time required to reach the effective dose for each patient can vary from weeks to years, and the lack of response in some patients may be upwards of 15%. Now, the unresolved issue of long-term effectiveness is very important because treatment must often go on for years, and current meta-analyses of random controlled trials have not answered this question effectively because of a lack of long-term treatment studies. Now, Swanson in 2019 identified 185 trials, but only one was for long-term treatment. And really, it was just a 14-month-long study involving only children with ADHD. Now, what Cirillo Urbina and colleagues in 2018 have found among trials of up to 1 year is that Adverse effects of stimulants in treating for ADHD mainly involve, in descending order of frequency, decreased appetite, headache, insomnia, irritability, nausea, abdominal pain, nasopharyngitis, dizziness, and somnolence, which somnolence is basically just sleepiness during the day. Now, there is also the existence of specific groups diagnosed with ADHD that must be attended to carefully to avoid complications, such as those with tics, as they can be exacerbated by stimulants, those at risk for substance misuse because stimulants can be addictive, and preschool children who may be particularly sensitive to stimulant treatment. Although heart rate and systemic blood pressure can elevate with the use of stimulants, the increase is not significant enough to reach abnormal range per age group. The average increase in systolic blood pressure is 3 to 4 millimeters of mercury, and the average increase in diastolic blood pressure is of 1 to 2 millimeters of mercury, and the average increase in heart rate is 3 to 4 beats per minute. All of this is according to Samuels and colleagues in 2006. Now, in contradiction, Dalsgaard and colleagues in 2014 found that children with ADHD treated with high doses, which is defined as methylphenidate over 30 milligrams per day for 12 months, were 2.2 times more likely to experience a cardiovascular event than were children with ADHD who were treated with smaller doses, under 30 milligrams. So, in conclusion, ADHD is made up of an array of factors from its intricate etiology involving genetics, prenatal and postnatal influences, to the neurobiological underpinnings contributing to its pathophysiology. While stimulants like methylphenidate are the first line of treatment for ADHD, their administration requires careful steps to ensure that potential adverse effects are avoided, especially in vulnerable populations. Genetic heritability studies have shown that there's a substantial genetic component to ADHD, and the studies emphasizing prenatal and postnatal factors further illuminate the relationship between the environment and genetics in the manifestation of ADHD. The dysregulation of dopamine and norepinephrine within the brain's motivational and executive function pathways are pivotal to the pathophysiology of the disorder. The hypoactivity of dopamine and norepinephrine contribute to the core symptoms of ADHD, which includes motivational deficits, impaired reward processing, and impaired executive functioning. This understanding of the disorder proves useful for treatments such as stimulants, including methylphenidate, to enhance dopamine and norepinephrine neurotransmission, which alleviates symptoms to a significant degree for most people. However, the limited long-term efficacy of methylphenidate and the common and serious side effects require careful administration from a qualified medical practitioner. Now, in addition to that, medical practitioners require more research on the long-term cardiovascular risks of methylphenidate to enhance their capacity to treat ADHD safely. So overall, effective treatment, particularly with stimulants like methylphenidate, demand a balance between symptom alleviation and risk aversion, requiring constant vigilance and individualized care to ensure that optimal outcomes are achieved while also minimizing the risk of adverse effects. I wanted to finish on a positive note. So although ADHD can be debilitating at times, one can still appreciate the way in which their brains are different. On that note, I will finish with the reading of a poem called In Every Moment by someone anonymous. An engine of ideas, never at rest, each thought a bird fleeing from its nest. In the realm of constant change, I jest, ADHD, the unwelcome guest. A mind that races, swift and free, across the landscapes of the sea, and through the canyons of decree, ADHD, it's part of me. Tumbled thoughts in disarray, in the chaos I find my way, a unique path, come what may, ADHD in colors gray. Like a symphony that's never done, notes scattered beneath the sun. Yet from the discord, harmony spun, ADHD, the unsung one. From distractions, insights bloom, in the cacophony I find room to live, to laugh, to loom, ADHD in life's grand plume. And I wanted to thank you for listening to my podcast, and have a nice day.